Hello, thank you for your interest in nursing at UT Austin. This is a mini information session to give you details about the alternate entry Masters of Science in Nursing program. This program is designed for those who have a degree, bachelor's degree outside of nursing and want to become a nurse and also earn an MSN degree. I'm going to start with a little background about UT Austin. We were founded in 1883, so it has a long history and has been around for quite some time, which I'm sure many of you are aware of this. We have 18 colleges and schools here at UT Austin, and that equates to about 393 academic programs. We have approximately 11,000 graduate students each year. And just to give you some insight to the enormity, we have 17 libraries, including online. We have over 10 million volumes of resources in the libraries, so it is quite large and extensive as well. The school also has 15 career centers. Nursing does have a career center here that for our students in our undergraduate and graduate programs. And UT Austin has about 482,000 alumni, which obviously grows every year. Some history about nursing. The first graduate program in nursing was offered in 1978. There were nursing programs prior to this date. However, UT Austin was part of a greater UT system school. So the nursing program itself didn't come into UT Austin until 1978. The AE program started in 1989. So as you can tell, we have been offering this program for quite some time now. And an interesting fact about it is that we were the second program in the nation to offer what's called an alternate entry, and in most places called a direct entry program. So we have a very long history of offering this type of program. Our dean at the time, her name was Dean Sands, was very forward thinking and really realized that there needed to be more graduate nurses in the nation itself. So that's why we started this program. Our current enrollment today, which is fall 2020, is 168 students, and it ranges about the same every year. So anywhere between 168 to 175. And this is really cool. We finally, in spring 2020, went over the 1,000 student mark of graduates in the AE program. So we have 1,018 alumni out there working as nurses all across the nation and in the world itself. And the picture you see there in the PowerPoint, the two in the blue scrubs were graduates, are graduates of our program, April and Veronica, and they had several trips where they went to Haiti to provide healthcare, and you can see all of the young people that they were providing healthcare to, and they provided them t-shirts. So I thought this is a great depiction of what an AE student can do as they complete the program. So since you want to become a nurse, I thought it was important to go over what your career opportunities are. RNs are among top occupations for expected growth through 2022, and I am sure it will be even more so after that, especially today with the Affordable Care Act and all the constant changes in healthcare. The expected growth that started in 2012 and will go through 2022 is 19%, so it is quite high. And again, the reasons for that is the Affordable Care Act, our aging population, including baby boomers who are retiring, and all of us are just living longer. So there's definitely wider healthcare availability. A lot of healthcare is moving into the homes and out of the hospitals, and nurses are on the forefront of making sure that care happens. And again, as I said, nearly 1/3 of our RNs that are practicing today are nearing retirement. So that's the baby boomers. So that leaves a wide opening for many new nurses. The top 10 states for the highest expected growth. You can see them all there. I'm not going to list them all, but I do want to drive your attention to number 2, which is Texas. So if you do live in Texas, it is one of the highest states for growth, and the first being Utah. All graduate programs have to have, well, they don't have to have, but all of your credible programs will have some kind of accreditation attached to them. UT Austin's program is accredited by AACN, and these 9 essentials are required for all AACN programs, which is most of the credible programs out that are being offered today. So all 9 of these essentials are embedded somewhere in the curriculum within our programs. Number 1 is practices, science and humanities. So that's definitely embedded in all the courses that you'll see. There's a leadership focus. There's scholarship to practice, so learning from the classroom setting and being able to take it out and provide and use that knowledge in your practice. Definitely quality improvement. I think that's a big focus in today's healthcare. And I'm sure all of you know informatics and technology increases daily, so having courses on that to upgrade and advance technology and informatics in nursing is very important. And a lot of that has to do with telehealth. There's telerobots that actually are in hospitals and clinics where there's a doctor on the other side, so it helps widen the availability of healthcare. Definitely policy and advocacy for healthcare and for nursing itself. Collaboration, so being able to collaborate with individuals from different aspects of healthcare, which is pharmacy, it could be social work, it could be radiology, it could just be so many things. So healthcare today really requires a collaboration of a lot of different type of healthcare people. Clinical preventions and population health, as well as advancing nursing to the graduate level or master's level. Another important aspect about these 9 essentials is this is something that you'll want to think about as you are applying to a graduate program in nursing, that you are utilizing these 9 essentials to come up with what your goals are as a nurse itself. So keep that in mind when you are thinking about your statement of purpose. We're going to get a little bit of the AE course sequence now. So this is how the program works. The first summer, the students start every summer. The whole cohort will start. They will take classes the entire summer. They will take classes in sessions 1 and 2, as well as the full summer session, and it is 9 credit hours. It doesn't seem like a lot, but when you're learning a whole new profession, really in nursing itself, which requires a lot of skill, it is very busy in the summer. And just think about it this way. You are learning all the skills that you need to actually go into a clinical setting and help patients in the fall. So that's 2.5 months of in-depth learning of nursing. And in the rest of the year, in fall, you will take 14 hours. In the spring, you will take 12 hours. And then we have something called Maymester. For the entire month of May, the students actually work the shift of their practicum coach, basically, is how it works. So, and then the fall and spring, they're going to be rotating through all of the levels of nursing, which is public health, psych health, child health, maternity health. So they're going to be going through all of these different rotations of classes and clinicals, as well as taking pathophysiology, which we call adult health. So they're going to be able to learn everything they need to learn to be able to sit for the NCLEX, which is the national exam to become a registered nurse. So that all happens in the very first year, and students must pass the NCLEX to move forward. And they move forward into their last, second and third year, where now they're going to focus on the concentration or tracks that they were admitted to, which will come up here in the next few slides. And then after that is the happy day of graduation. So that's the full AE course sequence. This slide gives you an idea of how the full first year looks for an AE student. So you can see in summer 1 and 2, all students are going to take courses together. As I said, you will take the first and second summer session plus the full summer sessions. So you can see those courses there. And then in the fall, on the top shows all the courses you'll take together as a group or a cohort. So you'll see there's 2 courses. Adult health is basically pathophysiology. You take a course and then you take a practicum. And then as you move down to these really busy section of this slide, you'll see different colors. How we work the AE cohorts is we put them in groups of 4. We label them A, B, C, and D. And each of those groups goes through the sequence at different times. So if all of us that are watching or listening to this information session, if we were put in group A, and that would be the very top line, we would start with public health. We would take the course plus the clinical, then we would move, that's 7 weeks, and then we'd move to psych. And at the same time, we're taking the fall courses with everyone else at the top. Then in spring, we will move to maternity health course and practicum, and first 7 weeks, and the second 7 weeks we do child health. And then of course at the top you'll see we'll take professional nursing management, we will take adult health 2 practicum, and then we will take the integration course, which brings all of the information together. And then you'll see down there the integration course, which is the month of May. Now if you look at all of the other ones down, you'll see the 4 areas or the 4 different students and their categories. So we were A, the next one would be B, C, and D. So B would start with psych and go to public health. C would start with maternity, go to child health, and D would start with child health and go to maternity. And then you can see they all progress in different areas. However, we all finish the courses at the same time. And we get all of the courses we need to be able to sit for NCLEX. So on to the programs that we offer. We offer 3 different programs in the alternate entry program. There are other areas in nursing that a RN prepared nurse can move forward into different areas. However, we only offer these 3 for alternate entries. The only NP, nurse practitioner program we offer is the psych mental health nurse practitioner. This is an advanced practice program. These particular nurses can see patients, they can diagnose patients, they can admit to hospitals, and they can prescribe medications, but only in psych mental health. So if somebody wanted to become a pediatric nurse practitioner, they would have to take a program that involves pediatric nurse information to learn that type of information itself. The second program is the Adult Gerontology Clinical Nurse Specialist. This is also an advanced practice program. And just to be clear, it's not working with just geriatric patients. Adult-gerontology means adult through gerontology. So this particular nurse practitioner, advanced practice nurse works with the population ages of 14 and up. And they can only function in the advanced practice area in those age populations. The difference is between the CNS and the NP is the CNS typically works in hospitals, in units. They work with their specialties in a disease such as cancer or diabetes, or even population health itself. They can see patients, they can prescribe medications, they can admit to the hospitals, but only that particular age group. I strongly urge you to look up what an AGCNS does, and maybe even look up the difference between an NP and CNS so you can truly understand what these 2 populations of nurses will do in their roles. The last program we offer is the Leadership in Diverse Settings. This is not advanced practice. So what that means is they will not have to sit for a different certification. The first two do at the end of the program to be able to function in those areas. This is for people that want to work in leadership, administration, become teachers, and there are lots of jobs out there that do not require advanced practice. And I always urge people looking into nursing and these programs is if you want to know what kind of jobs you can get that's not advanced practice, just go to a Google search, look up MSN jobs, and sites like Indeed will come up and you can see all kinds of jobs that don't require advanced practice. But to give you an idea, the MSN in Leadership Diverse Settings program, which we call LEADS, prepares graduates to promote health, advance care, and lead change in roles that do not require advanced practice certifications. The graduates are prepared to get jobs or assume roles in direct and indirect care. This is acute or long-term settings. It could be staff development, education. All hospitals have nurse educators, and this also means you could teach in college and universities. You could work in administration. It could be community health, primary care. You can work for not-for-profit agencies. There's corporate health settings that need nurses in leadership roles, health policy, government agencies. So there's many, many different areas that you can actually get a job as a non-advanced practice nurse. The most important thing to remember that as a nurse with your RN license, you can function as a nurse in any area. It could be maternity nursing, it could be public health nursing, you can work in clinics. However, the nurse practitioner or the advanced practice certifications allow you to function in a different level of nursing itself. So now I'm going to get into how we review and look at admissions for this program. Our admissions is a holistic file review, which means all of these areas that you see here on this screen, which are the admission requirements, have a value points associated with them. Holistic means those points are fairly equally distributed. So one area doesn't have such high points that if you don't do well in that, you can't get in. So the applicants with the highest total scores in all these areas will be offered seats to our program. There's 7 areas that we review. The first one is the prerequisite GPA. This is based on the 7 prereqs, which I will go over in detail in a few minutes. And the average GPA of admitted students is a 3.7 or an A average. So if you have an average that's below, let's say a 2.5, I strongly recommend retaking 1 or 2 courses to get that up, because that will just raise your point value in this area. The graduate admissions GPA is something probably different than most schools at UT Austin. Graduate admissions GPA is based on upper division courses taken at only 4-year institutions. So we don't use cumulative GPAs. We will take all of your courses. Let's say you attended UT Austin, Texas Tech, and Texas State. We will use all the courses in those 3 schools that were upper division. Upper division courses typically at most schools is 300, 400, or 3,000, 4,000 level courses. We do not use lower division courses, which most students will take in their first 2 years, but not always. And community colleges are not used either. The average of admitted students is a 3.5, which is an A average. You will have to take a GRE, and it must have been taken in the last 5 years. We suggest, we do not have a minimum, but we suggest a score of 300. The reason we suggest this particular score is that will give you mid-range points in the review itself or in the value point system. The average GRE of admitted students for all 3 programs as a whole is 305, and this is the verbal and quantitative sections together. The next area we will score and look at is your statement of purpose. The statement of purpose must be 2 pages. It must be a readable 12-point font, and it must be double spaced. So be sure and always follow the instructions implicitly as they are read, because you can lose points for not following instructions. You'll want to introduce yourself, why nursing, particularly why a master's in nursing, and what your goals are, how you plan to use this degree. And this kind of goes back to that slide I was mentioning of the 9 essentials. So think about what your goals are as a master prepared nurse. So really important. Now you can, in the statement of purpose, also address any issues or things that may have happened in the past that you want to address, like a low GPA or a low GRE. You definitely do not want to spend a lot of time on it. You don't want to apologize for these things, but you do want, if you would like, you can tell them information about that to help them understand you as a person and why that was lower. You'll have to provide a CV or resume. There is no particular requirements. You do want to make sure that it is a readable font. There's no page limit. And you really want to focus on things that you have done well in your past. It could be scholarships, it could be development of ideas, implementation of programs, it could be research that was published. It doesn't mean you have to have these things, but these are the things that you really want to highlight in a resume. It's not a job resume, it's an academic resume. So even though you should list your jobs, you don't always have to list every detail or every area that you performed in, unless it relates to nursing. We do require 3 recommendations. One should come from a healthcare provider. We prefer an RN, registered nurse, a nurse practitioner, or a medical doctor. However, it can be others in the healthcare realm itself. The other 2 can be any kind of reference that's going to give you a great reference that's not a friend or family. So that's really important to know that. It could be a boss if you're in a marketing job. It could be that boss, but you definitely want to educate your references to as to what you're applying to, and so they can actually think about your skills and what are the relatable skills or transferable skills that you would use in that job to nursing. And it will help them provide a different recommendation other than for a job. And also keep in mind, these are a form. This is not a written recommendation. They will get an email once you apply. They will rate you in skills, and then they will have 2 narrative questions that they should try and write as much information about you as possible. So educate your references, very important. And the last thing is 80% of the applicants will get a faculty interview, which will also be scored. Our procedures are this. The application is only open August 1st through October 1st, and it is always the year prior to the program start date. So if I was applying right now, this is September 2020, I would be applying right now for summer 2021 start date. You submit the online application at applytexas.org. You will pay the application fee, and you will have to put your reference names in here. It's very important that you apply as early as possible to give your recommenders enough time to complete the form. You do not have to upload any documents to the Apply Texas website. All the documents are uploaded to a secondary site. You will get an email from Graduate Admissions on how to get to this site, and it's called your My Status page. In this page, you will upload the following documents: all your official transcripts from every 4-year institution you attended, and all of your community college transcripts where you took a prerequisite. Official means that it must be dated 1 year or less from the date you're putting it in, and it must be either a paper transcript or an official PDF or electronic transcript from that institution that you upload. You will have to provide your GRE score that comes directly from ETS, the organization that provides the GRE test, and you'll have to use 6882 is the university code that you put in the ETS system. You can put it in at the end of taking your test, or if you've previously taken it, you can go into the website and order that transcript, that GRE transcript or score. You'll have to upload your statement of purpose, your CV or resume, and there is a prerequisite check sheet that you as the applicant must complete telling us where you have taken your prerequisites. It includes the course numbers, the course, the dates you took them, the schools you took them at, as well as grades and credits. Now, some of them will not have grades because you can be taking some of them as you apply. And again, I will go over that in a few minutes. If you're an international student, you will have to provide TOEFL scores if you did not attend a U.S. institution or an institution at an acceptable country where English is the first language. And that's all on the graduate admissions webpage at UT Austin. Now, here's the prerequisites. You have to have 7 of them. It includes anatomy with a lab, human anatomy, and we consider A&P1 with the lab is anatomy. A&P2 is physiology, so that is the second one, physiology, A&P2. It also requires a lab. The third course is microbiology. You do not need a lab, but you can take it if you like. Pharmacology. Pharmacology must be general pharm. It cannot be psych pharm or some other variation of pharm. It has to be general pharmacology. Human nutrition, again, the same as pharm. It can't be a variation. It can't be sports nutrition. It has to be full human nutrition. Human growth and development, which has to be lifespan development. So from conception to death, the psychological aspects of human growth and development. So if you've taken a course in adult health or child health specifically, we will not take those. You have to take the full lifespan. However, if you did take child health and you can take an adult health, we will combine the two. And the last thing is statistics. This does not have to be particular to healthcare. It can be business statistics, biostatistics. As long as it's a general statistics course, it is acceptable. Again, you must make a grade of C or higher. And just to be aware, C minus is also acceptable because we do not recognize minuses and pluses, which means if you made a B plus in a course, you will just get a straight B as far as coming up with the GPA. And again, the average GPA in the prerequisites is a 3.7 or a average. The policies about prereqs. You must complete 5 prereqs by December 31st of the year that you will apply. Of those 5, these 2 are required: anatomy or A&P1 with a lab, and general microbiology, plus any other 3 that you want to take or have already taken in past courses. Now, the next policies has to do with the length of time that you could have taken them, but it's only a few courses. So the following prerequisites must have been taken in the last 6 years from the program start date you wish to enroll. So if we're applying this year, our start date is summer or June 2021. So you have to go 6 years back from June. Anatomy, physiology, and pharmacology. So all 3 of those have to have been taken in the last 6 years. We do provide free prerequisite transcript reviews. You would email me directly at tdemchuk@nursing.utaxas.edu, and I will complete that. It does not have to be an official transcript, and then I can provide information about the courses you've taken in the past. So we're going to finish up with a few more slides. These are just some basic details that could be important to you. So miscellaneous information. So of the application, for application data itself, we receive approximately 120 to 140 applications. We admit approximately 60 students as a whole to the AE program. However, these seats are distributed among the 3 concentrations. The leads, or leadership in diverse settings, we typically get around 50 to 60 applications, and there are 35 to 38 seats. So most of the seats, over half the seats, go to the leadership program. For the CNS, we get approximately 25 to 35 applications. for 15 to 18 seats. And the site mental health is the most competitive for the number of seats and the most amount of applications. We have 7 to 10 seats for 50 to 60 applications. So one interesting aspect of our admissions is we will offer, since we get such large applications to the 2 advanced practice programs, the CNS and Psych, we will offer a number of these applicants to move their application to the leadership in diverse settings if they don't make it through the full review of Psych. So there is an opportunity to actually still attend UT Austin under the leadership program. So we contact the applicants at that time, give them information about how to move their application. So that is something that we definitely do, because we do want the top applicants to be admitted to this program. The cost of this program is between $39,000 and $45,000. The $39,000 is the leads and $45,000 is the advanced practice programs. And if you are going to be not a Texas resident, you're coming in from out of state or international, the program is basically double, $73,000 to $83,000. And you do pay per semester at UT Austin, and the more credits you take at UT, the less it is per credit. So the first year you're required to take the amount of credits that we offer, so you don't have to worry about that first year, but it is important to understand that if you follow the full-time schedule, you will pay less for your program at UT Austin. So some information where, this is just information to help you understand nursing, understand some of the information I provided. The Master's Essentials, which is those 9 essentials I gave, that's the web page itself. However, if you just Google Master's Essentials, you'll find it. I also like to provide information or provide this link about the future of nursing. It's a summary from the Institute of Medicine that really gives some details about the future of nursing. I believe a new one has just come out itself. So if you just Google future of nursing, it will give you some insight into nursing for the future and what that means for you to become a nurse. And the last thing is, if you're still trying to figure out what you want to do as a nurse, or if you want to become a nurse, I strongly recommend going to discovernursing.com. This is a great way to find out information about nursing, the areas that you can move into, what you can do as a nurse, pay scales. There's even a scholarship page on this particular site as well. So, and do a lot of research on nursing. If you're looking at nurse practitioners, look it up in Google. Try and find information to help you make the best decision for your goals itself. So I do thank you for your interest in nursing at UT Austin. And I am the Assistant Director for Graduate Academic Services. I am your contact for this program. It's always far easier to reach me email. And my email is tdemchuk@nursing.utexas.edu. And that is spelled TDEMCHUK@nursing.utexas, that's UTEXAS.edu. You can also reach me by phone at 512-471-7927. However, I am only in the office on Mondays right now. So again, it's far easier to reach me email. So thank you again for attending or seeing this information session on YouTube. And we look forward to seeing your application in the future. Have a great day.